Hello, my name is Lauren Cox. I'm here today to talk about the effectiveness of video modeling as a teaching technique for students with autism. As you may know, autism is a cognitive disorder where the individual is challenged with social and communicative skills. Autism rate is currently at an all-time high, so much so that the percentage of students with autism in the United States has increased 15% over the past 2 years. Working in a school with an ABA program, I have taken a personal interest in students with autism. One thing in particular that has interested me is how to effectively teach these students new skills. Other teachers within my district, along with myself, agree we would like to assist these students in learning so they do not feel excluded from the rest of the middle school population. However, a lack of education on how to teach these students has made this challenging. We do not know how to properly and effectively educate students with autism. Through research, I have found an easy technique that all teachers can use for students with autism. This technique is called video modeling. Video modeling is when either the child or another individual is videotaped performing the task. The student can then view the video as many times as they need before they attempt the task on their own. In order to set up video modeling within the classroom, this teacher must follow 3 simple steps. First, the teacher must identify the targeted skill. Once the targeted skill is identified, the teacher can then create the video. Once the video is made, the teacher will then implement the video into the intervention. The reason video modeling is so effective can be described by Albert Bandura's social learning theory that says, students with autism must be shown the desired behavior. Video modeling allows the student to view the task broken down step by step. If the student is able to practice the skill and the success of the skill results in a desired outcome, the student is more likely to display that positive behavior. When the child is able to see what behaviors are appropriate, this is beneficial to them because children with autism are very impressionable. There have been multiple studies done to determine how video modeling will be the most successful. One study done had students who were presented the information using regular modeling, while others were provided the information through video modeling. Both were effective, but the students who completed the task via video modeling performed better socially. Through this study, we were able to see modeling as a whole is effective. However, aspects of video modeling, such as being able to view the video multiple times, makes it more successful. When performing video modeling, it is also important to incorporate technology. Within a second study, a child was given an iPad that he used on a daily basis. Therefore, he was comfortable with the technology and was familiar with how to use it. The child was given the iPad to view a couple of social tasks. The same child was then given other social tasks that he was supposed to do without the use of technology. When the child had the iPad, the child's score increased over 20% in both trials. This is a drastic increase, as typically autistic children struggle in social situations. I have found it is also important that the child perform the task themselves in the video. Within a third study, 3 children were provided different tasks. The children were given one task where the student themselves was videotaped and then provided a different task where someone else was videotaped. When the children were videotaped themselves, all 3 met the required criteria of 80% accuracy. When someone else was in the video, only one of the 3 children was able to meet that same criteria. The video should also include verbal cues within it. This way, students are able to see the task and hear step-by-step directions on how the task is being performed. Lastly, I have discovered the child will do better when there is audio. If there are verbal prompts set up within the video, the child is able to hear the steps of the task being performed as they are seeing it. To determine this, a study was done where a series of tasks was presented to a group of children. All tasks were presented in a visual format, but only one of the two given tasks were provided audio. All the students who participated in the study were more successful when the directions were provided with audio. In summary, I have found video modeling is most effective when the child is filmed performing the task, when there are verbal prompts throughout the video, and the video is shown on a device where the student is comfortable. If used properly, video modeling is a strategy that can help a child learn social skills as well as facial expression cues, which is another huge area of difficulty for students with autism. To prove video modeling is successful with facial expressions, an academic group performed a study where some children were shown facial expressions with a video and some were shown the same facial expressions on paper. The research found that when provided with a video, the children who were trying to examine facial expressions were able to not only examine expressions outside the classroom, but were also able to generalize expressions in different scenarios. When students were taught social communication skills through vivo modeling, only 50% of the students showed improvement. When compared to video modeling, 100% of the students performed better when it was presented with the video format. Some of the reasons video modeling is so effective is because students with autism are generally visual learners, meaning they learn better when the information is presented to them in a visual format. This being said, it is beneficial to the child to see the task being performed before they are expected to attempt the task themselves. When they are viewing a video, it decreases the amount of external stimuli, which keeps the child more focused on the video. Students are also able to replay the video as many times as they need, and they are able to see and hear the steps of the task. This repetition will assist the student in understanding and remembering the steps, as children with autism need to see the tasks being done multiple times before they are able to mirror that behavior. When the child is hearing the steps, they are also seeing it being performed. The child is then fully able to understand what they need to do in order to complete the task. I have found this strategy also promotes independence, as the student is responsible for playing the video as many times as they need and communicating to the teacher if they are confused or need to view the video again. With there being no teacher prompts for the student to replay the video, it becomes the student's responsibility to communicate that lack of understanding. Video modeling is easy to implement within the classroom and promotes repetition, as discussed earlier. Video modeling also shows the new skill being used in real-life situations, so it's more relatable to the student. When the child is able to see actual situations in which this behavior should be used, they are more likely to mirror that skill in similar situations. Lastly, the skill can be reinforced at home as well as at school, as videos are easy to transport and view from different locations. I believe teachers want to play a role in autistic child's education, but lack the knowledge of how to effectively teach these students. If provided with the education, teachers would be happy to interact more with these students. Many educators do not remember this, but these students are still part of the school community. We are doing a disservice to these students by separating them from the rest of the students. If teachers get the education they need and become more involved, I believe the student will have a more positive school experience.